Welcome to the Global Sales Mentor Podcast for conversations that drive growth. When you are ready to grow your international sales, join the conversation with your host, Zach Selch.
So thank you for joining us. I am here with my friend Julio, and we are going to talk a little bit about driving international sales, another conversation that drives international sales growth. And I'm trying to bring in an eclectic group of people from different parts of the world. And Julio is Colombian, which is where my wife comes from. And Julio really focuses on sales within the Western Hemisphere, going from Latin America and North America and back and forth and different things. And he has a lot of great experience with that. So I'm just going to jump in and ask Julio to introduce himself and talk a little bit about what it is that he does, because I think he has a very interesting perspective compared to some of the other things that I've talked about.
Excellent. Thank you, Zach.
Julio, welcome, and thank you very much for joining us.
My pleasure.
So maybe you could just introduce yourself and talk a little bit about what it is you do.
Absolutely. We are a contract research organization and a market access consulting firm that helps medical device companies from the US and also other life science companies, biotech, et cetera, from the US to do business in Latin America in basically two fronts. One front is early stage clinical research, and the other front is market access or market entry, how to find distributors, how to do local market research, how to obtain regulatory approvals, et cetera. And we focus particularly in Colombia for many reasons that we can talk about.
Well, the Colombian medical market is a great market, so I can understand that. And very often when people are trying to get into especially life science things, the regulatory is a very big problem, right? And sometimes it's even the thing that scares people most. When I talk to people and they're talking about expanding internationally, very often what they say is, well, I'm not quite sure about how I'm going to deal with the regulatory. So what you basically do is you help companies with their regulatory process, right? Across Latin America. And you do that pretty much in virtually every country in Latin America, right?
Yeah, we help them with the regulatory process, but however, our scope, Zach, goes beyond that.
Of course, because it goes beyond that. It also goes into the research and finding the distributors.
Exactly. Yeah, and also clinical research in case they want to do studies to validate the technology, studies to facilitate physician adoption in the market, to gather local clinical data, to show local key opinion leaders, etc. So we go beyond what the typical regulatory affairs consulting firm does. In pretty much every country, you find a regulatory consulting firm. Ermergo is probably the leader, and some other ones.
Yeah, that everybody knows them, right? Exactly.
Exactly. Yeah. And you find attorneys that do that in pretty much all countries in Latin America, etc. Right. However, we go way beyond that because we realize, Zach, that these companies need really hand-holding in many instances. So the regulatory affair consultant, the typical service provider in this sector, it's short. It doesn't really fulfill the needs of these companies. So we go way beyond that. We give them a regulatory strategy. We give them advice. We give them commercial strategies, reimbursement strategy, etc. Everything that needs to be done to make sure they ensure long-term success in a particular market. And we focus in Colombia. We have an operation in Colombia because we believe that Colombia is probably one of the best countries to start doing business in Latin America, both in clinical research and also sales. And we partner with some other trusted partners or companies in other countries in Latin America to make sure our clients have a full service provider here.
That's great. So I'm always telling people how important it is to choose markets correctly when they're expanding internationally. And I also think that Colombia is a great first market in Latin America, or one of the first two markets in Latin America to go into. What can you tell me about the success you've had in getting companies to sell in Colombia and then go from there to expand into other parts of Latin America?
Yes, the reason why many companies choose Colombia is, I would say, first, is the third largest economy in Latin America. It's the third most populous country in Latin America. It has a top performing
And it's
universal
nicer
healthcare
in a lot of
system.
ways than the two bigger ones, right?
That's true. It's a lot more fun, and that plays a big role in doing business.
Right.
So the regulatory approval process is fairly straightforward. INVIMA is a level 4 regulatory agency, but overall, there are 4 countries in Latin America that are OECD aligned. The Organization for Economic Cooperation and Development is the club of wealthy countries around the world that have recently included Latin American countries, namely Mexico, Peru, Chile, and Colombia. And these 4 countries are putting together what is called the Pacific Alliance, which is the wealthy club, or the club of wealthy countries in Latin America, or countries where it's a lot easier to do business.
Right. Now, remind me, if I remember correctly, if you bunch those 4 together, what are they? They're the 7th or 8th largest economy in the world, right?
Yes, great point. It's about the 8th largest economy in the world.
Right.
Yeah, it's about 200 something million people.
All speaking one language.
Yes.
And like you said, they don't have the bureaucracy. I've never had a problem with anybody not paying me from Colombia or from Chile, right? Or you get money out. The bureaucracy is relatively simple, right? So if you're doing business with those countries, you're avoiding, and don't get me wrong, I love Argentina, but sometimes they have trouble sometimes food, but they have trouble sometimes with their currency, right?
Yes, and very unstable economy.
Right. So I've had people say to me, look, I can't pay you for another 180 days until, I can free up some foreign currency. Never had that problem with Colombia or Peru or Chile or Mexico, right? Mexico's currency has dipped a little bit, and Colombia's currency has dipped a little bit, but again, those are between those places, if you were to look at that, you could say that's a really good, solid place to do business, right?
Yes, absolutely, absolutely. The other aspect of it is the geographical location of Colombia. A lot of companies choose Colombia as their headquarters for Latin America. For example, Johnson & Johnson just opening a $40 million headquarters in Bogota for Latin America. Amazon and other countries.
Look, good airport, right? Good airport.
Yes, one of the top airports in Latin America, Bogota.
Not that far from not that far from Miami, right? It's you can fly out 6,
2.5, 3 hours.
Right, you fly out 6, 7 a.m. from Bogota. You're in Miami by 9 o'clock, and you can get on a plane someplace else, right?
Exactly.
So and and the crime is nowhere near what it was when you were a kid, right?
Oh no! I mean, it
totally
has shifted. Yes, very different. Actually, I was reading some stats the other day, and they were saying that the crime rate in Washington is a lot higher than in Bogota now. Washington D.C. Some parts of Washington D.C. Maryland, Baltimore is really scary there.
Definitely. No, so that makes perfect sense. And when you're dealing with life science stuff, with medical devices, right? Colombia has now, again, you take a look at it, Colombia has some great hospitals, right? In Barranquilla and Medellin.
Great point.
A lot of very advanced surgical techniques, cancer treatment. I want to say in Medellin, they do lung transplants, right?
Yes. I would say so.
Very good medical. Right, very good medical facilities across the board. So they're buying high quality stuff. They trust Americans.
Yes, very much.
They
love Americans.
They love Americans.
More than that,
right? Yeah. So
actually, I'm sorry to interrupt, but you're bringing up a good point. Colombia is considered the Israel of Latin America. In other words, it is the most protected country in Latin America by the U.S. Empire. In other words,
I've never heard that, but that makes perfect sense.
Yes, because of strategic location, because of the political dynamics that are happening here. Colombia is one of the wealthiest countries in the world in natural resources,
Yeah.
And that is right next to Venezuela, is right across the
Yeah.
pond from Cuba. So
Right.
you have all these socialists, leftists, communists, whatever you want to call it, regimes trying to
Yeah.
get a hold of Colombia because it's really the most precious jewel in the region for the Spaniards. That's how it was.
No,
The
no,
vice kingdom of Spain was
yeah.
based in Colombia and in Mexico.
All the gold used to leave out through Cartagena, right?
Exactly.
Yeah.
Yes, yes. So Colombia
That's-
has a interesting history, and everybody wants a piece of Colombia, and that's why it's heavily guarded by the Americans.
Yeah, that makes perfect sense. As an American who's done business in Latin America, the other thing I can tell you is it's a really good way to do your week. You start off in Buenos Aires, you do Santiago, then you do Lima, you do Quito, you end up Friday morning in Bogota, and then you fly home on Saturday, right? It's a pretty good week that way. It's pretty neat like that. Yeah, great. So what are some of the challenges? I mean, there are lots of stereotypes about the cultural differences between Latin Americans and North Americans. But what would you say some of the challenges are in understanding from a cultural perspective, understanding business culture? You know, your typical gringo shows up in Bogota, goes to a meeting, and what would you teach him about that? What would you tell him to do differently?
I've been in situations like that so
I
many times.
bet you have.
It's funny. It's so funny. I mean, to see the gringos trying to understand what's going on. First of all, the meetings never start on time. Right. Second of all, probably 15 minutes into the meeting, everybody is still speaking about personal stuff, about the news, about their families, about the soap opera.
Yep.
And everybody wants to get to know each other. And sometimes for Americans, it's hard to understand because they want to get straight to the point.
Right.
Just they're there for business.
Exactly. And I'll tell you what, American business culture is what we call situational trust. I show up, I'm a VP, I trust you, I expect you to trust me. That's it. We don't really need to know each other.
Yeah.
Colombia is totally different, right?
Yes.
You have to talk, you have to get to know each other, you might have to have a meal with somebody, right?
Yes.
And that's one of the...
You find people in common. That's also key. You find who we know in common. So we know that we can trust each other. Yeah.
A while back, I went for a road trip in Colombia with my mother-in-law. And I was joking. I said, you know, an American goes to check into a hotel and you fill out the form, you give them a credit card, they give you a key, and that's it. When a Colombian goes to check into a hotel, it becomes an hour conversation about mutual friends. You know, because you find, I know somebody who was here before last year and she was such a nice lady and blah, blah, blah. And a lot of talk and stuff goes on. Yeah. But it's not a waste
to see the dynamics.
Oh yeah, but it's not a waste of time. You simply can't do business without, you can't cut it off. You can't say, look, I don't have time for this. Right? It doesn't work.
You can avoid it. You can avoid it, especially Scotch. Sometimes Scotch gets in the way and you need to have it as an American, even if you don't like it. That's part of the way it works here.
There you go. It's funny. I haven't been to Venezuela for a couple of years, but I used to say they have fantastic rum in Venezuela, but everybody wants to drink Scotch because they don't want to drink.
It's one of the largest consumers of Scotch in the world, actually.
Exactly. It's really interesting because they have such good rum, you know, but there you go.
Yeah. Everybody wants to be a foreigner. And that's the thing around here. Everything that is American, everything that is imported, everything that is British, Scottish, Irish, German is highly regarded as a product of quality. Highly valued. So, and that applies to medical technologies, especially that now that you have all these Chinese products, Indian products. So the FDA certificate is really, it really helps get into the market.
That's been my experience.
If the price is right.
Yeah.
The value proposition is right, of course.
Right. But they do want good quality stuff. And honestly, if you go into, not every hospital in Colombia, but you go into a lot of hospitals, you would not know that you're not in America, right? At a good hospital in America, right? It's across the board, top of the line equipment, top of the line beds. Everything is really good. And the doctors are really good. The doctors in Colombia are fantastic. Yeah.
Let me say something about that, Zach.
Please.
That's also an excellent point. There's a ranking, annual ranking that a magazine, a prestigious magazine in Chile does. It's called America Economia Magazine or something like that. And they publish their annual ranking of hospitals, the best hospitals in Latin America. And Colombian hospitals are always in the top 40, 50% of the best hospitals in Latin America. And you are also bringing another point, which is the fact that a lot of the physicians here, because of the geographical proximity with the US,
right.
like my brother,
exactly.
And they sometimes train in the US, they go for rotations in the US, they spend a few months in a hospital in the US. A lot of doctors do the UCM, USMLE test in the US, trying to get into the US system. Sometimes they fail, they come back to Colombia, or sometimes they spend a couple of years in the US, they do the residency and come back to Colombia, and whatever. I mean, in different personal reasons, but a lot of them come back. So you have bilingual doctors training in the US, board certified, some of them. So yeah, that's what you find.
And my feeling is, from my experience, is getting a good reference site. Let's say you get a good reference site in one of the good hospitals in Colombia. You know, if you're selling an American product that isn't yet in Latin America, and you can get it into one of the good hospitals in Bogota or Medellin or someplace like that, because you meet a doctor who studied in America, who did his residency in America. Now you have a reference site in Latin America. And you can go down to Chile or Peru or Brazil or Argentina, and you can say, look, I'm in one of the good hospitals. And the other funny thing that I like as a reference site in Medellin is you have a hospital that's right next to the airport. So you can fly people in, go to the hospital for a reference site and get out. It's really easy.
Yeah. San Vicente Fundación just built a world-class facility in the Rio Negro area close to the airport.
Yeah, it's beautiful. It's really beautiful stuff. Yeah. So, please.
No, I was going to say that now you're talking about reference sites. For example, if you say that you did a study or one of your key opinion leaders is the chief of cardiology or whatever at Fundación Santa Fe, for example, in Bogota. I mean, that's like the crown jewel of medicine in Colombia and South America. Fundación Cardioinfantil, also in Bogota, Clínica Country, Marley, etc. I mean, you have some top facilities. Actually, Colombia is a medical tourism destination. A lot of the hospitals, a lot of the governments or the healthcare systems in the little islands in the Caribbean send their patients to Colombia because they need high complex procedures, because they don't have the infrastructure for that.
They can't hold it. Like you go to Aruba, I think they have 250, 300 beds in the whole country. Right? So they can't have a good cardio. I mean, no offense meant if any cardiologist from Aruba is listening, but they're not going to have the same level of a cardiologist or an oncologist or anything like that, right? So so they
don't have the volume.
Exactly. Right. No.
They feed into Colombia. Same with Panama. Same with Ecuador. Even Peru, Bolivia. All these countries come to Colombia for.
When you're selling into Latin America, like you said, it's really a good first stop, right? Because you get in. You can find people who like Americans and so on. You get yourself a solid reference site, and then you can leverage that reference site to move to other countries in Latin America, right?
Absolutely. Now, that's a common strategy. Yeah.
I'm also going to say that about half the time I've had a regional manager based in Latin America, I've based him in Bogota, because again, what did you say in the beginning? Great airport. Right?
Yeah.
It's good. You can find well-educated people. I mean, you talked about the doctors, but there's a good business school too, right? So you can get a good person with an MBA, And maybe you can get somebody who has, a few years experience working for one of the US headquarters, right?
Yes,
And
that's something that we use for recruitment. We look for people who have worked for a US-based company in Colombia.
Exactly.
Because they get the training, the US mentality, the structure.
Exactly. You grab some guy who spent 5 years at J&J, he's going to be a good guy, right?
Yeah.
And, and maybe he doesn't want to work for a big corporation anymore. Maybe he wants to work, at a higher job with a smaller company or something, right? So it's a great way to snag people.
Exactly.
And you have a lot of people like that. You have a lot less in other countries in Latin America because a lot of places, like you said, headquarter in Bogota, right?
Yeah, exactly. And you find a lot of smaller countries. I mean, Latin America has 33 countries or so. So unless you're in Mexico or Brazil, you are in a very small country.
And that's not even counting are you counting the Caribbean? That's without the Caribbean.
No, counting the Caribbean, 30-something countries. Latin America, the English-speaking Caribbean, the French. There's there's a French department or territory. There's another Dutch or something.
It's a lot of little countries. Exactly. Yeah.
It's very fragmented, extremely fragmented. Yeah. And that makes it challenging for U.S. companies to do business in Latin America because a lot of my clients say, like, oh, I wish Latin America were like the European Union.
I know, and it's always like, I'll tell you what, the Caribbean was always my nightmare because you can't find one distributor that can handle the Caribbean. You need five or six, right? 5 or 6. And then you're looking at, each one of them is going to pull in $250,000 a year, $100,000 a year, something like that, because there just isn't enough volume. But you can't have one guy doing all the Spanish islands and the Dutch islands and the English islands. They don't do it. You never find somebody who can cover everything well. So I always had a lot of trouble with the Caribbean. It's a difficult area to cover in a cost-effective way, right? And then you end up with somebody out of Panama who is managing 6 distributors and he's taking 7% off the top. So now your prices are up, right?
Exactly. Or from Miami too.
Right. Or from Miami or something. And you're going, well, how come my prices are so high on Aruba? And you're like, well, you have a distributor and then you have another distributor, right? So
there's like 5 middlemen.
Right. So what else can you tell me about that's unique or close to unique about doing business in Latin America that people in America should hear, in North America should hear about, before they come down, that will give them a little bit of preparation?
I think something unique is that nobody is in a rush here somehow. Life, the world vision, the world view is different.
And yet it gets done, right? Everything gets done.
Everything gets done. Yes, everything gets done. But everything is about mañana. Yeah, there's no rush. Take it easy. But Americans, and I consider myself an American too. I'm a U.S. citizen. I've been in the U.S. for 25 years.
It's always sort of funny to be in that middle where you understand both cultures. I know.
Yes. I know. And my company act as a buffer so that my clients do not have to suffer so much.
That's really good. I'll tell you what. I used to work with this company. And it was really funny. We had a very, very nice, sort of like a demo area in the factory where you could come in and see our devices and everything like that. And you could get coffee delivered there, but if you did it, you had to fill out a form 2 weeks in advance.
What?
Because you had to fill out a form for everything you wanted that day, and you had to give it in 2 weeks in advance, including the coffee. Wow. Now the thing is, if you wanted coffee, you had to say the people are showing up at 9 o'clock. But if you said 9 o'clock, the coffee came at 9 o'clock or 8:55. Yeah. So if you were having people that were supposed to come at 9 o'clock, you'd say, but you know what? If they show up at 9:30, the coffee will be cold. But if I ask for coffee at 9:30 and they do show up at 9, then we don't have coffee for half an hour. And I used to say to people, come on, I'm getting people in from Latin America. I don't know when they're going to show up. Can I get some hot coffee? Can I just pick up the phone and say, now bring the coffee? And they said, no, they have to show up at the time they're telling you they're showing up. And I'd say, I can't tell them that they have to show up at 9 o'clock, right? They're not going to show up at a specific time because I told them to so that we could get hot coffee. Yeah. And I couldn't get anybody in my factory to understand that. And it was the funniest thing because, yeah, sometimes they'd show up at 9 o'clock. Sometimes they'd show up at 10 o'clock. And, they were right. They were like, well, I woke up, breakfast was really good. I wasn't in a hurry. I called my wife. You can't argue with that. Those are all perfectly good arguments.
Yeah. I have to deal with things like that all the time, Zach. For example, I'm trying to set up a meeting with somebody in Colombia, and they tell me, I text them. WhatsApp is widely used here.
Yeah.
You send them a WhatsApp message. Hey, I want to meet with you. When are you available? Wednesday afternoon. Okay. What's Wednesday afternoon? Is it 2? Is it 2:15? Is it 3? Is it 4?
Yeah.
Is it 4:30? Is it 6? Oh, we'll see. We'll speak in the morning and we'll set it up. I'm like, I have to schedule my week. I have to put it in my calendar. So I can't block the whole afternoon, Wednesday afternoon, because this guy hasn't given me. But that's the way it is. So then you have to remember, set a reminder to send him a text message in the morning, Wednesday morning, to set up a specific time in the afternoon. So
exactly, but that's the way it works, right?
Yeah.
On the other hand, like I say, business gets done, goods get shipped. Yeah. People might be running a little late, but we're still doing a lot of good business, right? And a lot of people are making, a good living selling products from North America into South America, right? So it's really a good market. And in the end of the day, you take away these things like people a bit late for a meeting or whatever, there's still a lot of fun to do business. I have some great friends from Colombia and from Peru and from Chile, from Brazil. I mean, and Argentina, a lot of great friends from Latin America. I've had some great experiences. Yeah, and I've sold, well over $100 million over the years in Latin America. I mean, it's a great market. Sure. Yeah.
And also we forgot to mention the language. I mean, if you speak Spanish, that will make things a lot easier. You have an idea how frustrated some of my customers sometimes are when they sit in a meeting with me and the locals, and everybody starts speaking Spanish and everybody's talking to each other.
Very quickly.
And they're like, what's going on here? Their face is their head is like a fan going from this direction to this direction.
Yeah, no, that's true. But at least that if you get a regional manager in Asia, there's no way he speaks all the languages. But in Latin America,
that's a great point.
Essentially, you have two languages, and there are a lot of people who speak.
And they're very similar, by the way.
And they're very similar. So it's very easy to get a good, solid regional sales manager who obviously speaks fluent Spanish. Pretty good English, and can get by in Portuguese.
Yeah,
right?
It can get by in Portuguese. Yeah.
And that's very, very common. But when you're dealing with Africa, you're dealing with Europe, you're dealing with Asia, there are so many different languages. You're never going to get somebody who speaks all the languages,
Yeah. Interesting point. Yeah.
It does make things easier. Also, if you have to translate your manuals into Spanish and Portuguese, that's two languages, right? If you have to do a little bit of paperwork or that kind of thing, everything in Latin America, it isn't exactly identical, right? And also the Spanish is a little different, right? The Spanish in Argentina and the Spanish in Colombia are a little different.
Yeah.
But it's the same language, right? You can get by. And that's very
and the region is homogeneous, culturally homogeneous.
Exactly.
Everybody pretty much has the same background, Spanish background, European, Spanish background. The
Right.
American influence is extremely strong in all countries.
Right.
So you find homogeneity in the region. Unfortunately, the regulatory pathways are not so homogeneous yet.
Yet,
But eventually, that will get fixed with the Pacific Alliance.
I agree with
some
you.
other
I think we're
paths.
going in that direction. I think we're
Yes.
going in that
Yeah.
direction. Great. Great. Two more questions, because we're talking a little, or one more question. We're talking a little bit about healthcare products. We're both from the same background with that. Best show. What do you prefer? Do you prefer FEMA or Hospital R?
Hospital R. FEMA.
Me too. Me too.
Yeah.
I'll tell you what, like I haven't had a booth at FEMA in years, but I've been going to Hospital R for about 20, 25 years. I almost get the feeling that the people who go to FEMA are from the Caribbean more than they are from South America. And the real business, I do really solid business at Hospital R. I'll usually show up at FEMA without a booth. I'll just meet people and talk to people. But the real business in Latin America gets done at Hospital R, right? I wanted to see what your take on that was. Yeah.
Yes, I agree. And FEMA has now a lot of Indian and Chinese products. Hospital R has probably more advanced German, more high complex products, more innovative.
Yeah, I think you're right. And that might tie up with the whole Latin America, Caribbean thing. FEMA also has a lot of booths that sell used and refurbished stuff.
Yes, exactly.
And I don't remember ever seeing that at Hospital R. So people from FEMA are going to send me a letter bomb probably now.
I was going to say, Zach, that, for example, in Colombia, it's illegal. There are restrictions to import used equipment.
And you know what? That's happening in more and more countries now. And I think it's going to hit that whole business of refurbished. It's going to be interesting. It's going to be interesting.
Yes. Yeah.
Well,
yeah.
Julio, anything you want to tell us about your business, just to sort of give yourself a little pitch to the people who listen?
Yes, absolutely. I think Colombia has positioned itself as one of the best countries overall in Latin America to do business in many sectors of the economy. Since we're talking about life sciences or healthcare or medical technologies, let's dig deeper into that. In terms of clinical research, before we started operations in Colombia, Zach, Colombia wasn't really in the map for early stage clinical research for medical technologies. But just to give you a little bit of context to your listeners as well, my brother Pedro was really the visionary here of our organization, because he trained at Harvard at the Beth Israel Medical Center as an interventional cardiologist. He is the only Colombian who has been accepted to this program, and probably one of the only Latin Americans, or one of the few Latin Americans. And after that, he became a professor at the University of Miami, and he started getting involved with the development of several cardiovascular technologies in the structural heart space. So a lot of startups were coming to the university to tap into the knowledge of the team where Pedro was a part of. And some of the best interventional cardiologists were at that hospital at the University of Miami. So he started traveling to Paraguay, to Colombia, and other countries. And he quickly realized that companies in the US really suffer when they want to do business in Latin America, specifically for early stage clinical research, finding that key opinion leader, that investigator that can ethically and cost efficiently lead a clinical trial for an innovative technology that has millions of dollars in investment is sometimes difficult. And they sometimes go to Poland, go to New Zealand, Australia, far away places, Georgia, in the Eastern European area, Croatia, Lithuania, etc. And Pedro said, hey, there's a country here where I'm from
3
that
hours
has
away,
these
right?
potential, exactly. 3 hours away, great healthcare infrastructure, great cost savings because of the peso exchange rate versus the US dollar. So it makes it really cost efficient and ethical to do business here. for clinical research. So let's set up a company that helps these companies. And that's how we got started. That was our genesis. And organically, we were growing, and we started expanding our services to include market access services, so that companies that were already commercial, that had an FDA or CE mark product, could have help navigating the waters of Latin America. So in essence, that's who we are, and that's what we do.
That's great. Thanks. So I'm going to thank you very much for participating. And I'm going to tell people, when you are ready to grow your international sales, reach out to us. And when you're ready to go into Latin America, especially if you're in the health science area or medical devices, reach out to Julio. And
thank you.
Thanks a lot for your time.
My pleasure, Zach. Thank you for having me here.